Let's start with introductions. We have several people from our panel today that will be doing different parts of some updates for you. So hi again, my name is Jeannie Ong, and I'm the Director of Community Health with Advocate Aurora Health for the Chicago North region. Nicole?
Thanks, Jeannie. Excuse me. Good evening, everyone. My name is Nicole Edmonds. I am the Director of Community Health for the Central Chicagoland region. So I oversee Good Samaritan Hospital in Downers Grove, Illinois Masonic Medical Center in Chicago, and then also Lutheran General Hospital in Park Ridge. Thanks.
And Sandra?
Good evening, buenas tardes a todos. My name is Sandra Saldaña. I am the Cultural and Community Liaison at Advocate Lutheran General Hospital in Park Ridge. Y como dijo Jeannie, si alguien quisiera hablar en español o mandar un mensaje en el chat, con gusto yo les interpreto. Buenas tardes.
Kirsten?
Good evening, everyone. My name is Kirsten Peachy, and I am the Vice President for Faith Outreach for the Advocate Aurora Healthcare System for both Illinois and Wisconsin. Glad to be with you tonight.
And Megan?
Hi, good evening, everyone. My name is Megan Suzik. I am a nurse with Advocate Aurora Health. I am a nursing education professional development specialist and currently a lead vaccinator with Aurora West Dallas Medical Center.
Great. And we have 14 attendees that have joined us thus far. And I will go ahead and share the agenda for tonight. Can everybody see the agenda? Okay. So tonight we're going to cover several items to give you some updates on. And then we, as part of our regular design for our trainings, as well as our check-in sessions, we are always leaving open time for asking a question of a medical professional from Advocate Aurora Health. So that is Megan tonight. As you heard, she is a nurse who is a nurse educator, as well as one of the folks that is giving everybody their COVID vaccination firsthand. So she is here and available to answer questions that you may have. So to start off with, I did want to make sure, let me just, I'm going to stop sharing well, let me go through all of the pieces and then I'll share the first item. So we're going to take a brief tour of our brand new Vaccine Champion website. Hopefully you have all seen that and have had some time to walk through it, but if not, feel free to ask questions as I walk through that. Then Nicole is going to cover some updates to our top 10 things you need to know handout. Kirsten is going to let you know some more detailed information about the opportunity that is open right now for a micro grant for congregations and faith networks. And then Megan is going to give you some highlights from the CDC updates on Johnson & Johnson vaccine, because that has come back on the market since we met last, and she wanted to give you some updates there. And then we'll transition right into our Ask a Nurse portion. So I'm going to stop sharing briefly here and then pull over the website so I can share that with you. Okay, can you all see the website? Great. Let me just make sure. If somebody could watch if you have a question at any time, please enter it in the chat, or you can unmute yourself and feel free to ask. And I'm just going to walk us through here. So this is the new Neighbor to Neighbor Vaccine Champion website. Here at the top, right here on the right, we have posted for anyone who was not able to make the initial training. You can watch that video. The link to the English and Spanish versions of the meeting or the initial training is right there. Remember, we always have this website this email available for you. If you have any questions, you can just click right here and that opens an email for you to email us a question. Remember, as part of your starter pack that we sent out, we did send you the myths versus facts, I believe it was, handout in all of these different languages. We have also posted now another handout addressing vaccine hesitancy. And then right now you see the top 10 things you need to know about COVID vaccine available here in English and Spanish. The remaining languages will be added, as Nicole will cover in just a moment. This one has just been freshly updated, and so we wanted to get that updated before we translated it into the other languages. We were able to get that in English and Spanish for tonight. Then we have this middle section that has the information and vaccine resources. So these are some links. Here you can go in English or Spanish to link directly to our Advocate Aurora Health scheduling. So you can schedule a vaccine appointment at any one of our Advocate Aurora sites now. It's open scheduling. So there are several ways to do that, either via phone, via the app, or right on the website. There are some links here in the answer to vaccine questions to some additional educational resources. This is the FAQ section. So there's a number of frequently asked questions that there already are answers developed to. So if you're looking for something that you don't know the answer to or want more information, start here. And then you can also find out other resources in the community and where you can get access to COVID testing. There are some videos in this section from our doctors. We kind of call these, a lot of these are Ask the Expert videos. So regularly we update these with the updated videos that really kind of drill down with more detail on particular topics around the COVID vaccine. So those are there for you. And then at the bottom here, we have some great testimonies. And these are sometimes really good to share with others. These are a lot of folks that we have worked with in the community, or in some cases, some of our own employees who have gotten the COVID vaccine and are really talking about why they made the choice to do so, you know, kind of how they got there with their decision and why they made the choice. And then here we have access to some additional resources, the transportation support. There is a program through LISC that does have grants available for transportation assistance. So there's a link directly to that program here. COVID information at each of our state departments of health. That's a quick walkthrough of our website. I'm going to pause here. Does anybody have questions at this point? We have relatively small groups, so we have lots of time for questions if you need it, either in the chat or in, you can unmute yourself. Okay. And now I'm going to stop sharing and bring back the top 10 handout. And here's our top 10 updated version. So Nicole, do you want to take that?
Sure. Excuse me. Thanks, Jeannie. So I'm not going to go through all of the numbers listed on this handout. But we really want to be sure that we provide you with the most updated educational materials as you are going out into the community, having your conversations. And so this handout was actually sent to all of our vaccine champions. However, we've updated a lot of the facts that are listed on this handout. So numbers 5 and number 8, for example, those are kind of new facts based upon information that is newly released. Number 5 is really around the Johnson & Johnson vaccine, the FDA and the CDC, the blood clot issue. And then number 8, if you could scroll down just a little bit more. And then number 8 is around once you're fully vaccinated, you can start doing more things and you can stop doing that you stopped doing because of the pandemic. And it speaks a little bit more around that topic or issue. So we will be sending this handout via email. It will also be posted to our resource library that Jeannie just kind of walked us through on May the 19th. So you can also access this handout there after May 19th and after. And the handout will be in 8 different languages. So those same languages that we listed that you saw in the resource library will have all those languages for this handout. And then am I missing anything else, Jeannie? I'm trying to make sure I'm covering everything about this handout. And then as handouts are updated or as we receive new handouts or get new information, we will be sure to send all of our champions the updated information and those updated handouts. Any questions regarding the top 10? Okay, great. So expect that via email in the next couple of days. And with that, I think Kirsten, you're up next for the faith-based mini grants.
First, and before you answer or start, I should say that, Jeannie, there's a question in the chat about childcare resources. Is there any information about childcare resources?
At this point, there is not anything on the website, but we can actually explore that for you. Do you mind talking a little bit more, Joyce, about that in terms of what is there a specific geography you're looking for
Well,
childcare?
I saw it when I was reading through my champion information. It said that's one of the things that we should probably be able to provide for a person if they needed it. They listed transportation as a barrier and childcare as a barrier. You gave us some resources for transportation, but I was just wondering, did we have any listings for the childcare support?
Not as of yet. We are still exploring options because a lot of those are based on local geography, but we will kind of move that up on the list and try to get that posted sooner rather than later. So thanks for the reminder.
Okay, thanks.
Okay, Kirsten, I stopped sharing, so I think you're able to share your slides.
I will go ahead. Okay, so I'll just be, I won't go into a lot of detail, but we're trying many different approaches to helping people get connected to the vaccine. So we know that getting vaccinated is one of the main ways that we're going to be able to stop the pandemic. And so, we're trying as many different approaches as we can. And one of the things that we know is that people in the community often have very creative, very smart ideas for ways that they can reach people that they know, because they know the people in their congregation or in their neighborhood and know what maybe some of their questions are, some of their hesitancies are, or what might motivate them to get vaccinated. So one of the approaches that we're trying are these micro grants for COVID vaccination outreach. So I'll just tell you very briefly about it. The goal is to increase the number of people who get a COVID-19 vaccination. We have grants of $1,000, about 20 grants are available of up to $1,000. And these are geared toward faith communities. This is coming from our faith outreach program. So we're really focusing in on faith communities, faith-based networks, faith-based organizations that have an idea of something that they could do to increase the number of people who are vaccinated in their congregation or in their community. And we're really focusing on our highest need communities, the places where COVID incidence is highest, and where people maybe are the most hesitant to get vaccinated. So disproportionate impact is what we're looking at. And there's a list of zip codes that we have to be in one of those zip codes or have a very clear plan for working with people in those zip codes to be eligible. some examples of things might be to develop a kind of a, some flyers or some educational materials that are, again, really specific to your population or your community. You may want to have some kind of a program to help seniors register to get vaccinated. Sometimes people don't have a smartphone, or it's just really feels complicated to do it, and that's a barrier. So some kind of a program or project to help seniors, maybe providing stipends for youth to be able to reach out to older members of the congregation or in the community to help people sign up. There's one church that's thinking about creating some like a video, especially for youth, focused on youth, because there are a lot of youth that are not getting vaccinated and don't intend to get vaccinated. So any kind of outreach that you think addresses the barriers that are particular to your members of your religious community or to your neighborhood. So we're trying to keep it very simple. These are not big grants, so we don't want you spending a lot of time on a lot of administrative things. The deadline is May the 15th, so it's next Saturday at the end of the day, 11:59 p.m. on Saturday, May the 15th. We have an online version that you can fill out, very simple. All we're asking is, for your geographic information, for your idea of what you think you'll do with the money, how much money you think you'll need to accomplish your goal, and then any help or assistance that you think you might need to be able to implement your project successfully. So it doesn't have to be long, it doesn't have to be, with a lot of documentation, but we just want a really clear idea of what you're planning and how you think you'll use that money. So we have it online, but we also have it in a Word document form. You can just fill out and email to Julie, who's our administrator, who's overseeing this. We're going to make the decisions by May the 25th, and we expect to be able to have the checks available to you by June 1st. We will provide lots of support and check-ins over the course of the grant cycle. So the grant is only from June 1st through the end of the December 31st. So it's just for that time period. And during that time, we'll provide monthly opportunities similar to this for you to check in, to connect with other grantees, to share information with each other, share ideas, network, get support, get any technical assistance that you might need. And then at the end of the program, again, we don't want it to be burdensome in terms of reporting requirements and so forth. But we do want to know, what did you do and what were the outcomes? So we'll have a call with you at the end just to talk through how did things go. Is there anything you would have done differently? What did you learn? And then, what do you think your impact was? So, we're really interested in what was your goal? What did you do to try to get there? And then, how did you spend the funds? And how many people did you think what kind of an impact did you have? People are eligible, or faith communities are eligible across both Illinois and Wisconsin in our service areas. So in our Advocate Aurora Health service areas. So if you're in Illinois and you have questions, you would contact Amy McNicholas, and that's her email there. And if you're in Wisconsin, Anya Gordon would be your contact, and her email is there. We also have a recorded webinar that's available it's like 11 minutes long, so it won't take you long, but it also provides more background if you need more information. So that's the micro grant opportunity. Are there any questions or anything that you're wondering about?
I have
Maybe I'll stop. Well, I guess I can't see you anyway, so go ahead.
I have a question.
Yeah, Joyce, go ahead.
I was asked today, I was making a call, and they asked what type of technical assistance are we able to offer? What do we mean by that?
Yeah, so that might be, maybe you need just some consultation on, putting a budget together, or like really figuring out how to kind of manage the budget, or maybe it's about communication, like, how do we make this flyer most effective, and most kind of appealing to people, or, just kind of practical questions that you might have related to your project that we could either help you with or connect you with someone who could help you with, or maybe connect you with one of the other grantees who may be good in that area.
Okay, thanks.
Any other questions? We hope our goal is to get this money out to people and really support your efforts to reach people in your communities in the way that you know best how to do that. So we hope you'll apply and look forward to seeing your application. And we have this information in a very kind of simple form that's got all the links, everything that you need. And Jeannie, I'm assuming you have a way to like send this information out to everyone.
I did send that out to everyone already, but I would be happy to send it.
Too noisy for me.
I could send it out again if needed. Okay, I think next up is Megan.
Great, thanks, Jeannie. So to start out, I just wanted to provide some updates to the group since you last met at your kickoff and training sessions regarding the Johnson & Johnson vaccine. So for those of you that maybe or maybe not aware, the Johnson & Johnson vaccine did resume through approval from the CDC as well as the FDA throughout the United States. What they concluded on the findings for the Johnson & Johnson vaccine was that those rare but serious side effects can occur in a population ratio of about 7 people per 1 million. Those side effects or serious reactions included an occurrence of blood clots and low platelets. You might also hear about this being referred to as thrombosis or thrombocytopenia. In those instances that the CDC noted, individuals that were affected by this rare disorder were primarily women of childbearing ages, so women from 18 to 49 years old. It was noted that women and men greater than age 50 and beyond did not report any of these rare effects beyond their experience with the Johnson & Johnson vaccine. It is recommended that with the Johnson & Johnson vaccine resuming, that there will be additional what we call black box warnings throughout the labeling and distribution of the Johnson & Johnson vaccine to ensure that individuals are able to make a choice whether that's right for them, if they have previous health conditions that would warrant them not to receive the Johnson & Johnson vaccine, such as having clotting disorders already or any other issues or concerns. And they also concluded that the recommendation would be for a monitoring of up to 3 weeks post-vaccination, that the patients would monitor themselves for any unusual leg pain, shortness of breath, or difficulty breathing, any bleeding or easy bruising or breakouts of some blood vessel breaking on your skin that goes beyond the vaccine site. Those could all be indications of this rare but very serious condition. Does anybody have any questions beyond that for the Johnson & Johnson vaccine? Not seeing anything come up in the chat. So I do see a question, why is the Johnson & Johnson back on if there's already a hesitancy? And that's a great question. I found myself kind of questioning that as well, knowing that there was a lot of information and a lot of hype around the findings of these serious situations. And I think ultimately it comes down to the rate of people having the serious side effects is so low compared to the population that had already received the vaccine. So a total of about 15 million people had already been vaccinated with the Johnson & Johnson vaccine, and only 7 individuals were identified to have had this bleeding disorder or blood clots. I think ultimately the mission is that because it was deemed safe, we want to ensure that people have access to as many vaccine options as possible in order to continue with the vaccination process. And because Johnson & Johnson is the only single dose vaccine on the market currently for COVID-19, I believe that that was also one of the primary reasons it resumed. Any other questions around the Johnson & Johnson? Great. And then the other topic that I wanted to bring up before we open up for just otherwise open question and answers is just an update regarding the 12 to 15-year-old population and when we're anticipating their approval with the Pfizer vaccine. The latest update is that we're still in a waiting pattern for that approval, although it was slated to be announced by the end of this week. So I'm anticipating we should be hearing something about that even into the late evening hours today or as early as tomorrow, Friday, May 7th. And in anticipation of that, there was a Facebook Live event that Advocate Aurora did host earlier this week to go over children and the vaccine and what those findings consisted of. And it was a very positive study that was conducted by Pfizer. It indicated that over 2,200 children were put into the trials for the vaccine. And of those 2,200 children vaccinated, there was 100% efficacy, meaning that 100% of the people did not have COVID or get COVID during the trial, which is tremendous. So that's very exciting. It would continue as a 2-dose regimen for our adolescent population. So the same as adults, they would go through the same routine for the 12 to 15-year-olds as well. They also anticipate, and there is new talk that Pfizer is going to be continuing their trials and then recommendations to begin vaccinating 2-year-olds to 11-year-olds, and that could start for approval as early as this fall or this upcoming school year. So lots of exciting information coming out around children and the vaccine at this time. There has been no updates regarding Moderna and their plan to get approval for anybody under the age of 18. So for now, both Moderna and Johnson & Johnson are still only approved for 18 and older. Are there any questions regarding that coming through or any other Johnson & Johnson related questions?
I'm sorry. Hi, this is Denise with Access to Page. I have a question in regards to the Pfizer vaccine for younger children. I know that it has this, the study hasn't been out long enough, but is there anything that we should know in case patients ask about younger children that they're seeing, like Johnson & Johnson had the blood clots? Is there anything, any serious side effects that they're seeing now in trial with the children that they're using?
That's a great question, Denise, and thank you for bringing that forward. So in the study of 12 to 15-year-olds, there was no identifying of any severe reactions or any high risk, which was similar to the findings for the adult population with the Pfizer vaccine as well. So that's very positive. I have not heard of any findings so far in the reports of studies for younger children. So that 2 to age 11 group, they haven't reported much yet, just that those trials are continuing. So overall, the Pfizer vaccine continues to be proven as very safe and effective for all age groups that it's approved for and will be approved for. So those are all very positive findings.
Great, thank you so very much, because that's a question I know it's going to come up, especially in the population and the Hispanic community. They're already a little bit reluctant about vaccine. And then now with children and students going back to school, it's going to probably be a frequently asked question. So thank you so much.
You're welcome.
Megan, there's a question from Reverend Miguel. he says there are many people who distrust the J&J vaccine. Is there some indication that the people who are receiving this vaccine, who they are? So let me just clarify. Reverendo Miguel, una pregunta. Entonces, ¿usted quiere saber quiénes son los que lo están recibiendo? ¿Es lo que me pregunta?
Yes, I want to know who is receiving this vaccine because the I think the trust is for everyone, but especially for Latinos that they are really the concerned about this vaccine.
Yes, thank you for the question, Miguel. I will say that although the Johnson & Johnson vaccine is approved for all individuals, again, over the age of 18, because of those findings and the rare but serious side effects, it is recommended that women of childbearing age would not get that vaccine due to the blood clot risks. So they're still allowed to, but again, they're advised against it just based on those findings. I'm not exactly sure what the plan is across the country or in your particular communities about the distribution for the Johnson & Johnson vaccine, but I will say that Advocate Aurora, as we begin to resume vaccinating with the Johnson & Johnson, we are allowing our patients to choose if they want to receive that vaccine versus the other two options of Moderna or Pfizer. This is both because it's a one-shot option versus the 2 doses, because of the news around the side effects, and then overall efficacy that the Moderna and Pfizer tend to be more effective than the Johnson & Johnson. So I can speak that the Advocate Aurora approach is to, again, let it be a patient's choice when scheduling that vaccine.
Thank you. That's so. But do you know if the most of the places or where they have a clinic, a vaccination clinic, did they give the option to the choice which vaccine they want to, or they give only one? What do you know about that? Because it's a good point that you show right now. The options, but I haven't heard yet in the area.
Right. So for Advocate Aurora, the clinics that we're running, again, it's going to be a patient's choice if they want to receive the Johnson & Johnson vaccine, and only certain locations will have that vaccine available. If the patient wants the 2-dose vaccines of Moderna or Pfizer, we are not currently allowing patient choice on that due to the widespread availability of both. We tend to just go with what each site has for availability at any given time, and that'll determine what dose they get or what brand they get.
And Reverend Miguel, I think in terms of like mass vaccination sites that are run by FEMA or the state, my understanding, and we can verify this, but my understanding is they are kind of really basically dependent on what vaccine gets shipped into the state at that point in time, as far as what vaccines that they have available at the site. And that really can change week by week. So I don't know if some of the public sites will have that choice or not. I will verify that and find out and we will push that back out to all our vaccine champions.
Megan, there's another question in the chat. Are they still recommending the Johnson & Johnson vaccine for the homeless?
Yeah, that's also a very good question. So the option with Johnson & Johnson for homeless, or we've also seen it greatly used in our homebound patient populations, is the benefit of it being a 1 dose compared to a 2-dose series. This allows individuals who are maybe otherwise difficult to reach, such as the homeless or homebound, to still become vaccinated, but not have to report back for an additional dose to complete the series. So I don't want to speak fully to say that it's still recommended or encouraged for that population, but so long as they are of non-childbearing ages or over the age of 50, again, those risk factors are incredibly low. And they're incredibly low in general, but again, that older population, it would be very, very slim chance that they would have a blood clot disorder or reaction as a result. I also see in the chat that Mary Carlson said if you go to vaccinefinder.org, you can specify which vaccine you are looking for and schedule yourself accordingly. So that's a great resource. And I know it's updated very frequently, so you're able to follow along and make decisions as you go. All right, well, if there are no other questions based on the adolescents or Johnson & Johnson, we can open it up to just generalized questions now that either myself or some of the other panelists may be able to answer for you. So feel free to ask them in the chat or come off of mute and ask to the group.
Megan, this is Denise again with Access to Page. I've read a little bit and not reading too much into it in regards to some folks that receive one dose, they don't show up for the second. So in that situation where they receive one and they just for some reason don't receive the second dosage, will they have to start all over again, you know, down the line? Or
it depends on the time frame of when they were to come back for the second dose. So ultimately, we like to see patients receiving their 2 doses in the allotted time frame of either 21 to 28 days or 28 to 35 days. But we understand that there are circumstances around that sometimes prevent it. So our extended plan from that would be to have it done within 6 weeks, although we do recommend overall that 3 months is safe. And Jeannie, if you can verify with me, I believe you looked up what the CDC had said regarding that. Do you have any additional information?
You are spot on with that question. Yes, the CDC, and this is one of the frequently asked questions that we're going to publish that several people have asked. So yes, the CDC says it's okay to delay a second dose for up to 6 weeks after the first dose. There is no evidence that delaying the second dose makes the vaccine less effective. The first dose provides significant immunity and the second dose boosts your immunity even higher. Even if it takes longer than 6 weeks, it is important to get the second dose when you can to get the full benefit, and you do not have to start the vaccination series over again.
There you go. And with that in mind, it's also important that you want to make sure people continue to carry around that CDC vaccination card, because that will help them, you know, in identifying that they did in fact get at least one of the series, one dose of the series completed. So if they were to return, whether it's to the same facility or different location outside of that vaccination window, we are still able to verify that they have proof of receiving the first dose. Another question, will children get the same amount of vaccine as adults? And that is a great question. And the answer is yes. So their findings are that children would receive the same dose. So it's a 2-dose series. And because it's the Pfizer, the first amount is 0.03 ml, so a very minuscule amount of vaccine, followed by the same dose and the same potency, if you will, as the first. So another 0.3 to equal 0.6 mL, which again is a very small amount of vaccine or of any type of liquid in total. But it works the exact same, and it would be the same dose for both children and adults. Great question.
There is a question in the chat, Megan. Is there any consideration for those that are homebound to make home visits?
Joanne, I see that you posted that. Are you able to maybe provide a little further insight regarding that question?
Yeah, thanks. So I'm an employer, so this isn't our issue, but we do have some employees who have parents that they're taking care of at home who are not really able to get out of the house, or it's difficult. So I know the city of Chicago is doing some drive-throughs and some have taken advantage of that. But is there anything that they can do to help for someone who's really not mobile enough to leave their home?
I am aware of several counties that through their public health departments do have registered ways to register individuals who are homebound to get on the list for they have a mobile team that actually goes to the home. I know several counties in Illinois are doing that. So if you have a particular geography that you are concerned about or want to find out about, Joanne, we can certainly research that for you and get the information to you.
Thanks, that's helpful. Actually, just knowing to go to the counties will work. We have people everywhere. So that's a great place to start. Thank you.
Mm-hmm.
Any other questions or concerns that people might have?
Yeah, I got a concern. Many people thinking that, and I think that's can be a good option for especially for the Latino community, Latinx community, to have a Johnson & Johnson because it's one vaccine. But something I've been thinking about is the average age in the Latinx community is from 20 to 50 years old.
Mm-hmm.
So it's a pretty young community. So I'm thinking about what you say that the high risk in the women, from the 20 to 50. I don't know if you still recommend the Johnson & Johnson, and especially for this group of the Latinx community.
That's a very good point. And I thank you for bringing that up. So although the findings were 7 people that experienced these blood clots, or otherwise known as bleeding disorder of thrombocytopenia, we need to also remember that it was only 7 people in about 15 million total that were vaccinated. So although the findings were within those people ages 18 to 49, it was still such a small amount, which is why it's still been deemed safe and effective in administration. So I do value that concern, and I think that that would be a point that you could share with your community members, that they are valid in that concern, but that the risk is still very, very low. If they were to seek out a 2-dose series instead of the 1 dose, they would certainly do so, and it would be effective and beneficial for them as well.
Thank you.
You're welcome.
Other questions for Megan? Okay. Well, let me just ask you all a question. How this is our first check-in, and we want to always make improvements if needed. So if you could just give us feedback by coming off mute or in the chat, we would love to know if this kind of a format works for you, what things you liked and what things you would like us to make better. So we want to make sure that these sessions are useful, the most useful to you. Any comments for us?
I think it's a great idea. especially with so many different changes sometimes. So it's a nice way to stay informed so we can pass along the message to our patients and our people in the community with any concerns. So I think it's great. And you guys are doing a great job. Thank you so much.
Thank you. Yeah, we want to be a resource for you. So, and this stuff is changing so fast. You're exactly right.
And definitely you are really helpful. Thank you.
Great, thank you.
There's a couple of great comments in the chat. Really like the format. The formatted updates are done well as is the question and answer session. It's easy to, I like the format. You make it easy to ask questions. I think the whole thing is great.
Thank you so much.
See if there's another one.
Okay. Well, we plan to have these check-in sessions going forward on a monthly basis. I will say if things continue to change rapidly and we need to bring you more updates on a particular topic or just in general, we will have them more often or earlier. So, please be on the lookout in your emails, and we will, be communicating ongoing that way. But at this point, we plan to have the next one in 1 month, but if needed, we will have one earlier to give more timely updates. Okay, one last open period for questions. We still have time available if you have a question that you just thought of. Okay. Well, on behalf of the panel and the Vaccine Champion program, we are so happy you could join us tonight and hope you found this, beneficial to you to answer the questions. And again, if you have questions that come up anytime, just email that asc.vaccinechampion@aah.org email address. We watch that very closely all the time, every day. And we have one more question. Do you want to take that one, Megan? Some people who have had COVID seem to have more side effects after the first dose. Any suggestions to encourage them to get their second dose?
Yes, that is a great question, Mary, and thank you for bringing that up. So you are exactly right. Most often, individuals that have had COVID do experience more of that immune response or those typical side effects that we see after the first dose. And the reason for that is it's almost as if the first dose acts as that booster shot for those individuals. So although they might feel pretty lousy and might be reluctant to receive the second dose, it is still encouraged and recommended, especially that we find individuals that have had COVID are truly only producing antibodies for up to 3 months' time post-infection. So even though they've had COVID-19, they're only truly protected from that active infection for about 3 months. And then when they get the series, although your body still remembers it and gives you that immune response, you still want that second and final booster to ensure that your body is going to continue to produce those antibodies and protect you from further exposures and infection. So excellent question. I often joke it's a 2-for-1, right? So you want to get them both done, and then you know that you've got, close to 95% immunity from COVID-19, which I'm not sure how much people know about vaccine trials and studies, but it's truly unheard of to have such a high rate of effectiveness in a vaccine. So we're very fortunate that the technology is there allowing us to have that benefit and get as protected as we can be from this nasty, nasty bug.
Okay, I see no more questions in the chat. at this time. So I think we will close it up so everyone can go enjoy this beautiful evening. And thank you everyone for your time, and thank you so much for your hard work in the community. We really appreciate, we know that many of you are working full-time jobs or more than one job and still going out and sharing information in your neighborhood, at work, in your community. So thank you so much. And don't hesitate to reach out to us if you need anything else.
Thank you.
Thanks, everybody.
Have a great rest of